Hey fellas, today we're going to talk about bleeding control real quick. Lieutenant Beatty wanted me to put together a PowerPoint about some bleeding control technique we have for the TEMS team. Objectives we're going to cover real quick, discuss A&P of blood loss, review trauma triad of death, and cover common TEMS equipment to control bleeding. Blood loss, making an assumption, most likely found on a TEMS deployment, gunshot, stabbing, explosion, fall, altercation. Blood loss continued. Average amount of circulating volume in a child. 80-pound child on average has about 2.5 liters, which is about half of what an average adult has. Obviously more or less depending on the age and size of the child, naturally. Average amount for circulating for an adult is 4.5 liters to 5.5 liters. Average adult can circulate total volume of blood in 1 minute. The reason these are significant is blood loss amount, estimated amount versus levels of shock. Blood loss continued, large arteries and veins in the body, aorta, superior mesenteric artery, and the axillary and subclavian artery, and the femoral artery. The two in the middle are the arteries that run from your aorta down and into your arms. And then the large veins, the vena cavas, the axillary and subclavian veins, and the femoral veins. Trauma triad of death. This covers blood clotting factors, metabolic acidosis, and hypothermia. The basis of this is keep your patients warm, keep them with fluid, and keep them with oxygen. If they get too cold, they can start to lose clotting factors. If they get too acidotic, they can again stop clotting, which refers to low oxygen perfusion through the blood. And if they end up losing fluid too much, obviously they're bleeding out clotting factors. We want to add fluid to keep them regulated, but also we don't want to give them too much fluid. We can actually flood the clotting factors out themselves if they're currently bleeding, actively bleeding, and we are putting tons of fluid into them. So keep them warm, give them an appropriate amount of fluids, and keep them oxygenated. Bleeding control equipment that we carry, tourniquets, Elias bandages, and quick clot or wound packaging. I think we're all pretty familiar with all three. I chose to take a little bit of a deeper dive into tourniquet use, not specifically on SWAT members or TEMS members or adults even, but pediatric population. Quick cover TXA real quick also. It's 1 gram, or all of the medication in the vial, 100 mLs of saline, which is in the piggyback bag, over 10 minutes. So it's, if you remember, it's just times 10. It's 1 vial, 10 minutes, 100 mLs of saline, 1, 10, 100. And then you can feel free to use the Dial-A-Flow if you're not super confident on how to tie the piggyback in and dose it appropriately. Yes, you're going to be giving the max dose of the Dial-A-Flow is 250 mLs an hour, which is 50 mLs over 12 minutes. You can provide the full dose of TXA in 24 minutes, albeit it's much longer than the 10 minutes it's recognized for, or you're supposed to give it for. More importantly, it's consistent, it's going, it's flowing, and it's going into the patient. Is it the best way to do it? No, but in a pinch, if you need to, you can throw the Dial-A-Flow on there, and then you don't need to have somebody dedicated to figuring that thing out. So tourniquet use on a child, I chose to use some of the Websters as donated victims for this. No Websters were hurt in the recording of this PowerPoint. So here's Hudson. He is a 4-year-old male. He weighs about 40 pounds. He's about 3.5 feet tall. He's average build. I don't think he's any stats above 50% for the average child, the size of a 4-year-old child. The tourniquet fits just fine on his arm. His leg is bigger than his arm, so I chose not to do it on his leg. Fits great. This is Ari. He is 19 months old. He is about 30 pounds. He is a larger than average, almost 2-year-old, but he's not off the charts big. It fits fine on his arm, and he didn't want me to do it on his leg, so I don't have any pictures of it on his leg. If you don't tighten the band enough on his arm, though, there is a little bit of a gap in the plastic plate that runs up and under here, under the the actual device of the tourniquet. So you'll really have to crank that thing down, but it's more than big enough. And then here we have Patton, who is a soon-to-be 6-month-old male. He is a small child for a 5 to 6 month baby. I believe he is less than 10% on the body measurements for the average small baby, sweet little child. Now the pictures don't really depict it super great, so I'll make sure I send this PowerPoint out to everybody. But down here, you can see my finger tucked under the tourniquet. Again, up here, I tuck my finger in the tourniquet. My thumb is in the tourniquet here. This is just a picture of the tourniquet on his leg as high as I could get it in the bouncer. And then again, I tried to show the gap here, but it's a poor picture. But point being, the tourniquet is on his leg. Most importantly, for this size of a kid, I think if you really crank that thing, it would work. But if you're not serious about it and you're kind of dilly-dallying or second-guessing yourself, then it's not going to work. But if it were my kid and I had to make that thing work, I would absolutely be able to stop blood flow on that leg. So it's take away what it's worth. I'll make sure I send this PowerPoint out to everybody. The pictures are attached. I definitely slipped a finger in there, but it was a little bit of a tight squeeze. But I'm confident that on this 5-month-old, soon-to-be 6-month-old child, the tourniquet would work. And then any questions, please reach out. That's the end.